Hi guys, welcome to my YouTube channel once again. Today we are going to integrate. I'm going to try to begin to show you what goes through my mind when I'm not actively studying or doing anything related to study. When I'm just sitting down and I feel like helping myself remember stuff more. This helps me remember more, and it helps cut across disciplines more easily. Here's one major problem a lot of us experience as students. Step one, step two, CK alike. When you study endocrinology, you feel like a god of endocrinology. After you finish studying endocrinology, you do UWorld questions on endocrinology. You feel like you are an endocrinologist already. And then you move on to GI and renal and neuro. And by the time you're 5 systems down the line, it's like nothing is left. You've forgotten everything from endocrinology. By the time you get to the end of your studying, it's like you have to do endocrinology all over again because you don't remember. If you've experienced something like this, let me know in the comments. If you've experienced it and you were able to get over it, let me know how you dealt with that so that all of us can learn from your experience. Integration is something that helps you pull across systems all the time. It helps you not stuck in one system. So when you are studying gastroenterology, you want to be able to think about endocrinology. You want to be able to think about microbiology or infectious disease, whatever it is, if you're doing step 2 CK. When you are studying one system, you don't want your thinking to be only aligned in the direction of that system. The second thing integration does is increase the speed of remembering. Memory speed. So it's one thing to know it, to recall it after 20-30 seconds. It's another thing to know it and recall it in 5 seconds. So if I ask you a question, how long does it take between when I ask you the question and when you actually retrieve the information from your brain and present it? If you're studying GI right now, or you just finished studying GI, if I ask you about intussusception, you probably give me the answer like that. 5 weeks, 6 weeks down the line, when you're now studying neuro, if I ask you about the same interception, will the answer come like that? There will probably be a lapse. A 5 seconds lapse, for me at least, is okay. But when there is a 10 seconds, 15, 20-second lapse, think of it in an exam setting. That's where we begin to have problems. So what integration aims at doing really is to see how you could learn the information while you are studying other systems, review the information, and at the same time be able to recall this information on demand at a go. So when you're reading exam questions in real time, you're able to think out what are they asking about. Oh, this is it, this is it, this is it. And in the 1 minute 15 seconds, I don't know how long each question really takes. In the time given, you're able to actually recall everything you need to recall and get a full picture of the question and hopefully get the answer correctly. When I try to integrate, I do it most of the time when I have classes, but by myself, there are several ways I go about integrating. There are days when I'm really, really bored and I decide that, okay, what does it look like? The blood supply from the heart to the feet. Just think about that to yourself. Do I know the blood supply from the heart to the feet? That's, for some people, it's going to be easy. So come out to the aorta, blah blah blah, and then you get to the pedal arteries. Easy for you. Now, how about the branches of the aorta and what diseases are associated with different sections of these branches of the aorta or these blood vessels as we travel down? And that's what we are going to use as a template for today. The second way I integrate is I take a part of the body, like the hand. Take your hand, for example. What are all the diseases that can affect this hand? Just looking at the hand. Take a paper, take a pen. What are all the diseases that can affect the hand? From rheumatoid arthritis to osteoarthritis to Bethlehem myopathy to carpal tunnel syndrome to Goyon canal syndrome. You just keep going. All the diseases that you know can affect the hand, you just try to think of all of them. And each of them you think about, you want to remember the details about that disease that could be relevant to step 1 or step 2 CK, whatever the case is for you. That is the goal of integration. For the case of sake of this video, I'm going to use the blood supply from the heart to the toe. We'll do it for like 2 3 videos. I hope to get through it in that time. Hopefully I don't go into too much details, and we'll start it, we'll go with it. When we finish it, we'll look at different parts of the body. Just call it integrative exercise. Okay, we'll try to integrate as many systems as we can. Let's start with the heart. So if you think of the heart is this big guy, right? Just thinking about the heart, this will almost sound like cardiovascular system review in a sense. You're looking at this muscular structure. You want to be able to see the heart. So as I say the heart, I want you to picture the heart in your mind. I don't want you to look at a picture of the heart. I'll probably show you a picture here, but picture this heart. See the valves in your mind's eye. Just see the valves. See the mitral valve, see the tricuspid valve, see the aortic valve, see the pulmonic valve. Just see the heart in your mind's eye. What pathologies can be associated with this image you have in your head right now? Hopefully you actually have a picture of the heart in your head as I'm talking to you. Just think of all possible pathologies that you can see in your mind's eyes associated with this heart you are seeing. Start with the outside. You can see pericarditis. Think of the muscle, the walls of the heart. You can see myocarditis. If there is obstruction to the blood vessels supplying this heart, you can see MI, ischemia to the wall. You can go ahead and start thinking, what are the different stages of MI? The different level of changes that go on to the on the cardiac tissue when someone has an MI within 0 to 12 hours, 24 hours, 3 days, 7 days. You know all those charts in your first aid. You can think of that. Can you still remember all of those things? Then think of the valves. What are the different pathologies associated with these valves, from mitral valve stenosis to regurgitation? This is integration. You are thinking of it. You're not reading it. You are thinking of it. Just see the heart. I want you to keep that picture of the heart in mind and see these diseases. It's not as difficult as we thought it was. So you can see mitral regurg. Do you remember the sound you hear in mitral regurg? You can see the mitral valve, mitral stenosis. Do you remember the sound you hear in patients with mitral stenosis? What else can you think about with the mitral valve? Think of rupture of the chordae tendineae. Rupture of the chordae tendineae will also result in mitral regurgitation. Do you remember patients patients that are going to have this condition? Usually people with MI. Do you remember when in MI patients you're going to have rupture of the chordae tendineae? Probably day 3 to 7. You are integrating, you're recalling. Right here, you're almost doing CVS review already as it is, since we picked the heart. We talked about myocarditis. Think of myocarditis. What's the most common cause of myocarditis in the US? If they don't tell you it's autoimmune, they will attribute it to Coxsackie virus. So Coxsackie virus, do you remember the microbiology behind Coxsackie virus? What type of virus is Coxsackie? What class of virus is Coxsackie? Do you remember that there are 2 Coxsackie viruses, Coxsackie A, Coxsackie B? Do you remember the details of each of these 2 viruses? Now, because I'm making a video and I'm not intending to teach you on this video, I'm not giving you all the details about all the things I'm thinking about. If not, this video is going to be 5 hours long. If you want me to do something like that, as we integrate, I break down every single thing and do every single thing, let me know in the comment section. And in the next series, I'll choose a very small niche and I'll do that actually. So we can also do that if you guys want that. So Coxsackie, do you remember everything about Coxsackie? Do you remember what Coxsackie A is associated with? Do you remember what Coxsackie B is associated with? That is microbiology you're already talking about. You're reviewing some microbiology right there. Do you remember that the black widow spider causes myocarditis? Do you remember that? Do you remember other causes of myocarditis? But these major ones are the ones they'll ask on the exam. If you've thought of it to this point, you've already covered the most likely question you're going to have on your exam concerning myocarditis. Do you remember low flash endocarditis? And so on and so forth. Let's retrieve a bit. We talk about the tricuspid valve. Are you seeing the tricuspid valve? Do you remember patients that develop problems with tricuspid valves? Do you remember that they are IV drug users? Do you remember that people with carcinoid syndrome are also going to have tricuspid valve pathology? Are you thinking these thoughts? All I need you to do is see the heart in your mind's eye. See all these parts of the heart and follow with what disease can affect each of the individual parts. You look at the wall of the heart. That wall of the heart can undergo hypertrophy. Since we are still looking at the muscles, those muscles can undergo hypertrophy. What can cause them to undergo hypertrophy? Are you thinking of hypertension? Are you thinking of hypertrophic obstructive cardiomyopathy? What else can happen to the walls of the heart? Are you thinking of restrictive cardiomyopathy? Can those walls become stiff? Can they become less compliant? Restrictive cardiomyopathy. What else can occur? What can happen to the walls of the heart? What if someone has cardiac tamponade? Those walls cannot stretch as well as they can. What we've done is go through a whole lot of differentials in cardiovascular pathology. We've been talking about the walls, the valves. How about the atrium? Think of the left atrium. Can you picture the left atrium? Can you think of pathologies associated with the left atrium? Can you think of atrial myxoma and the ball valve effect? Can you think of what else? Atrial fibrillation, when there is stretching of the walls of the atrium. Can you picture that? Can you see that in your mind's eye? These are the things we are talking about. And then when there's a problem with the left atrium, do you remember that if you go into someone's esophagus, if we go into someone's esophagus, do you remember that the atrium sits right in front of the esophagus? So you can basically do transesophageal, what do we call them? Echocardiography. You can go into the esophagus and look into the atrium from the esophagus. Do you remember that anatomic relationship? A whole lot of integrative material can come out from just seeing the heart in your mind's eye. I don't want this video to be long, so I'm going to stop at this point. That is a good example of what integration is. In the next video, we are going to follow the blood supply from the heart to as far as we can go in like 5 minutes. So I want to keep these videos very short. In like 5 minutes, pointing out differentials. What I want you to do is, as I give these differentials, you fill in the details. So if I say atrial myxoma, you remember everything about atrial myxoma. If you notice, we skipped rhabdomyosarcoma. Its association with tuberous sclerosis. As I'm talking, I'm having ideas. I'm remembering these differentials. I'm remembering these diagnoses. In your own time, as you think of them, as these differentials come, you fill in the details about every one of them. We'll continue with this. We'll start with the aorta and with the right atrium, and we'll go as far as we can. We'll just be mentioning differentials, and as I mention differentials, I want you to think about it. If you want me to elaborate on each of the differentials, then let me know. I would have to compromise. Either the video is going to be very long or it's going to be short and I'll talk about fewer things. I hope you found this video useful. I hope you got one idea for integration. Close your eyes, see that organ. Close your eyes, see that structure in the human body. The human body is amazing. Just imagine the lungs, imagine the kidneys, imagine the hand, whatever, and see how you can pick out every single pathology you can. Of course, there is a limiting factor. The limiting factor is how much you know. But that's still okay. As much as you know already, think them out. If you can as much as remember the disease, but you don't remember the details about the disease, that's okay. Write down those diseases. You don't remember the details, look up the details. By the time you do that twice, thrice, 4 times, 5 times, a lot of diseases will reoccur and you will become more accurate about them. You would know them more than you did before. And that is integration for you. I'm going to see you in the next video. This is getting longer than I planned for. I'm going to see you in the next video. Let me know in the comment section what you think. Have you been doing this before? Do you have to read and read and read again? Or would you prefer to just sit down and imagine, see this structure in your mind's eye and go through the different pathologies? By the time you do this, I can promise you that you're going to do way better than you are doing already. Let me know what you think in the comments, so that I'll know how to arrange this the next time we do it. Thank you very much. Remember to like, remember to subscribe, and I'll see you next time. I'm sweating.